My name is Representative Mike Fitzpatrick from Pennsylvania. I'm joined by Representative Slaughter of New York State, and we're here to announce the introduction of two pieces of legislation introduced just about 10 minutes ago. One is called Ariel Grace's Law, H.R. 5403, and the other is the Medical Device Guardian Act, H.R. 5404. I just want to start out by thanking most especially the families who've traveled from across the country, from great distances. These are families representing individuals and some individuals who are here with us who have been harmed by medical devices that for the most part, many devices, they do, great progress and great success, but every once in a while there's a medical device that will get approved through either a fast-track approval or a more rigorous approval that may do more harm than good. And that's what we're here to talk about. I want to thank my constituents, Representative Dr. Amy Reed and Dr. Huma Noor-Chazem, who awakened me through their personal story as to a serious problem in the medical device approval process, the medical device safety space. There are many issues we deal with in the United States Congress, and it took them bringing it to me to get my attention and to bring us to where we are today. And so I want to thank them for, as Frank said, their persistence and perseverance, but their passion and the care and compassion they have for other unsuspecting women who have either undergone the procedure and don't know what happened or are at risk of being injured by a medical device. So for the last year or so, since I met in my Bucks County office with my constituents, I've been meeting with patient advocates, I've been meeting with medical device experts, agency heads at the FDA, department heads, independent researchers, and I've found several troubling problems when it comes to medical device safety and medical device process review in this country. From flawed data to slow reaction time blocking legal recourse, hundreds of thousands of Americans are being harmed by the very medical devices that they and their physicians have turned to for help. And while we all agree a majority of the medical devices can and should prove to be invaluable life-saving products, we must also note that some well-intentioned products can cause harm. Laparoscopic power morcellators are used for hysterectomies and to treat uterine fibroid tumors by morcellating them or essentially grinding them up. However, if the blades hit an undetected fibroid cancer, it will spread the cancer throughout the body, taking stage 1 cancers immediately to stage 4. Despite this, not a single person, not one person, had reported this deadly effect to the FDA until Amy Reed, a mother of 6, a doctor, and my constituent, underwent morcellation, and her cancer was spread throughout her body. Dr. Reed's patient report to the FDA was the first ever adverse event report received by the FDA regarding morcellators, despite her same hospital having had patients harmed by morcellators a year earlier. After the initial report from Dr. Reed, hundreds of other safety reports began to flow into the FDA. But it should not have been falling to the patients to bring this to the FDA's attention.
I'm proud to support these reform bills and want to talk about one in particular. 3 bereaved husbands came to see me about this power morcellation, and I was absolutely stunned at the idea of what was happening, and we wanted to understand, why did the FDA ever approve such a thing? For more than 2 decades, a device called laparoscopic power morcellator has led to the deaths of hundreds, if not thousands, of women all across the country. Its blades have spread an undetectable fibroid cancer throughout the body like shrapnel, taking a stage 1 cancer to stage 4 and almost immediately. As a result, what should have been a routine procedure has ended with a death sentence, and that is why I am working very closely with Congressman Fitzpatrick to get the Government Accountability Office to investigate the FDA's approval of devices and to talk about, report all of their failures. And they are at work on that as we speak. They are being very thorough about it, and we'll be glad to share the results with all of you when we get them. Sad reality is that power morcellators have devastated families and stolen loved ones, not just in Rochester, but all across the country. But it wasn't a manufacturer or healthcare provider that sounded the alarm, despite of all the damage that was being done. It took a patient, Dr. Amy Reed, who is with us here today, a doctor, a mother of 6, to file the first report to the FDA following her own surgery with a morcellator. For me, this whole procedure has never been about statistics or numbers on a page. I heard the personal stories of my constituents. What had happened, they'd lost a loved one as a result of something that seemed totally unnecessary and perhaps not too well thought out to begin with. The idea of macerating a tumor, not knowing what is in all of it, and spreading it all over the peritoneum. A few months ago, I met with Frank, who told me about his beloved wife, Linda. I also met with Rochester resident Jim Leary, who lost his wife, Barbara, and George Liuzzi, who lost his wife, Brenda, after an undetected cancer had been spread by morcellation. These women were in the productive years of their life, doing great work, and just really cut down by a procedure that makes no sense. For each of these men, the circumstances were the same. Frank's message was a simple one that continues to resonate with me. And he said that if we truly value patient safety, we should be guided by a simple principle. First, as all doctors know, is do no harm. It's time to make these reasonable changes to help us live up to that simple ideal. And I'd like to welcome Frank. I've lost track of him. Here he is, right behind me, to say a few words. Frank, welcome to Washington. Thank you for coming, and we all regret, as you do, your loss.
Thank you. So I've been asked to say a few words today from a patient's perspective, from the family of a patient. All of us share a similar sad story. I'd like to acknowledge that the 3 families from Rochester, New York, that were all victims of power morcellation. Brenda Liuzzi, Barbara Leary, and my wife Linda, who passed away a year and a half ago. Louise spoke very eloquently about the gaps in our regulatory and medical systems that allowed this to happen, so I'm not going to touch on that. So I thought what I could do is maybe share with you 2 things that Linda actually said about the issue, and give you just a touch of the background. Linda was diagnosed on Halloween 2013. She died a year to the day after that. Her surgery was 10 days before she was diagnosed, and by the time we got the diagnosis, the cancer had already been disseminated through her abdomen because of power morcellation. Now, I was lucky enough to have been married to a best friend and a true love, 30 years, 11 months, and 2 weeks. And she was a great wife, a terrific mother to our 2 children, Katie and Grace. She was a loyal friend. She was an animal lover to the extreme, even including our goofy mutt, Darcy. And her death, like the deaths that have happened to so many of us, it leaves a void that's never going to be filled. So although she was a very private person, Linda did make her story public because she wanted to make sure it helped others. And so husbands always get in trouble for trying to speak for their wives, so I'm going to just quote her. These were 2 things that she actually said. The first is this: there is no justification in the world for a doctor making my condition worse when it was absolutely avoidable. I had hopes, dreams, plans, and a life I loved. In short, I am a human being, not a data point. Something to bear in mind in each and every single case. And the second thing she said is, my most fervent wish is to make sure this never happens to anyone else. And, certainly thanks to the courage and tenacity of Human, Amy, so many other people who came on board, the media reporting that brought this to the public eye. Significant progress has really been made in curtailing the practice of power morcellation. And knowing what we all know here today, it's inconceivable that the practice still goes on, that there are doctors and professional associations that still support the practice, but it does happen. So I think that's why today is especially important, that what Congressman Fitzpatrick and Congresswoman Slaughter are doing here today is moving forward again and trying to remind doctors to first do no harm, which is where all doctors need to be. So I thank you for your persistence, and I encourage you to keep it up because it will save more lives. Thank you.